began to explore this whole area of primary care and dentistry when I was working actually in hospital systems a while back, and more recently because it's become dominant in the conversations that are happening in dentistry. And I was looking around for who are the people that were ahead of me? Who are the people that have really seen the future in this domain, and what are they doing about it? And the people that I spoke to, Doug's name came up every time. It was like, wow, whoever this guy is, he's connected. He understands where the future is going. So I met Doug at the Coy Center not too long ago, and I asked him if he wouldn't mind doing the interview with me, because I'd like you to hear what he has to say. I think it's critical to the future and where dentists are going to be and dental practices are going to be in the not too distant future. So Doug, why don't you take a moment, introduce yourself to the crew, and we'll get started on the interview.
Yeah, thanks so much, Mark, for the opportunity. I appreciate it. I was Doug Thompson. I'm from Bloomfield Hills, Michigan. I have a small practice in a suburb of Detroit, and it's a general practice. I'm a general dentist, and I started in 1980 in the laboratory business, and I was a lab tech for 10 years, and then I became a dentist. Upon my graduated from the University of Michigan, and then I spent 1 year at the university hospital doing general practice residency in hospital-based dentistry. And there, Mark, I started to see a lot of collaboration between the medical team and the dental team in doing pre-surgical exams, pre-surgical clearance for certain patients. And then I went out and bought a private practice in Bloomfield Hills, and I saw none of that in private practice. And always being fascinated with the bacteriology or the microbiology, if you will, of caries and periodontal disease, I started to take periodontal disease quite seriously and got the pleasure of meeting John Coy's. I started in John's continuum of courses. And in John's continuum of courses, he said something to me very early on that was impactful. And he said, wouldn't it be really interesting if we could diagnose or predict disease or even prevent disease before people express those diseases? You know, couldn't we get to them earlier? And so then it just took me into a whole journey of personalized periodontal medicine, really developing a strong periodontal medicine program around looking at microbiology and looking at what the causative factors of the disease are and what things we could, manipulate or control. And I got into microbial testing, the personalization of clinical data, and then it just took me into the world of cardiology and preventative cardiologists, and it's just grown and snowballed from there. And I think we as dentists are going to have a great opportunity in the future to be involved much more heavily in collaborative medical dental care.
Yeah, I believe from an economic viewpoint, the way I see it, it's also a fait accompli. Healthcare costs 64% of the population sees a dentist, probably more frequently than they go to the hospital. A hospital visit is $680 per minute. The dental visit is less expensive, and we'll go down that tunnel, I'm sure. You call your process, your practice, integrative oral medicine. So what does that mean? What does that mean?
Yeah, it was kind of tough because when I developed the term, I felt it was from the heart. It was what I really believed I was doing. However, like any good branding, the branding really should state more clearly what it is that you're doing. However, when I explain it to patients or when I share the name and what it means with patients, they totally get it. But when I started to look at the mouth and I started to look at how far-reaching, I think right now in periodontal disease, we're up to 57 cross-reference diseases that are related to that disease entity alone, notwithstanding sleep apnea and acid reflux and other erosive things that contribute to the detriment of the dentistry and to the human body. And when I started to look at all the ways it connects, it was impossible for me to separate the body from the mouth. And so there became this integration. And when people ask me, what do you do? It's integrative oral medicine. I'm kind of an oral medicine, rehabilitative dental specialist. And at the same time, we have an opportunity to integrate all these different opportunities in dentistry with medicine. And so I decided to rebrand the practice, integrative oral medicine. I did that quite a few years ago. And now the IOM kind of methodology, which was built on Coy Center principles, the IOM methodology has become the hallmark foundation of our wellness dentistry network, which is which is a collaborative group of other dentists that want to initiate these kind of concepts into practice. And so it's fantastic. It's impossible to separate the mouth from the rest of the body.
Good for you. So this is a question. So as this thing expands, it becomes more dominant in a practice, and we'll talk about your model and methodologies. How is it going to relate to the whole healthcare system? How is it going to be integrated? It's integrative. How is it going to integrate? This is an aside, I worked in a couple of hospitals in the 90s and early 2000s, and I found their interaction, and it may be totally different now with electronic patient records and all the other stuff that's going on. How are dentists going to integrate into that system?
Yeah, I think it's a great question, Mark, that I think is going to be, it's going to have to be massaged by business minds and people that, can help see the best way. But I think that dentists are going to be on the front lines of primary screening. And if we can control some of the inflammatory conditions that are evident by looking in the mouth and by working in the mouth, I think that there's enough studies now that show the medical cost savings and the medical benefits that there will be some insurer or some medicine group that's going to understand the significance of that, and they're going to put that best foot forward and agree to have patients either screened at a more significant, tighter screening level, or evaluated more closely than we are now. I mean, now our stats are showing that we're only treating about 1% or surely less than 5% of all the periodontal disease. So they'll start to remunerate us for doing a better job and keeping a tighter profile. And if we can back that by some medical metrics to show that patients have either better controlled inflammatory biomarkers or some metrics, which we're starting to collect now at a very rudimentary level in dentistry, I think then we could more prove that the significance of dentists cleaning up the mouth and keeping the mouth more pristine is going to have huge cost savings down the road. We know that diabetics are going to have better control, and the care of the cost of diabetic and diabetic wound care. We know that stroke victims and heart attack victims, and then what about all the people that we might be able to predictively prevent a rise in biomarkers that could trigger an inflammatory cardiovascular event? What kind of cost savings could that be? It could be immense. So I think time will tell how that's going to happen. But right now, my objective into integrative oral medicine, and I don't want to mislead anybody. We don't treat many of these things. We discover them and then we ship them off, and we collaborate with physicians who are happy to treat these diseases earlier and to more succinct endpoints. That's really where I think we're going to go.
Okay. So I would say that a majority of the audience is going to be dentists who watch this interview. There'll be others who are top-end officers and investment guys and banks, but the majority of dentists are now in their head going, what do you, be more specific about what you, if I'm a patient, what do you do for me? How do you do it for me? And how do you introduce it to me?
Yeah, with our existing patients, Mark, we're looking at any, because a lot of doctors are going to know, what do I do with my current patient base? And I think one of the springboard disease entities in dentistry that is such a big opportunity for us is periodontal medicine. And if we don't have periodontal protocols that are really tight, and I mean a periodontal policy, a vision for how you want your periodontal patients cared for, a comprehensive exam, a thorough probing and pocket depth measurements and recession on all your patients, so that you can create a graphic roadmap to tell them if their disease is progressing or stabilized or even regressing. A very accurate chart that would display inflammation. And unfortunately, the crudest rudimentary thing that we have right now in dentistry is bleeding on probing. But we should not allow our bleeding patients to walk out of our office without them understanding the significance of that bleeding, and that it's a sign of inflammation, and that means that something in their body, some biomarker somewhere, is going to be triggered by that excess inflammation. And since that's our wheelhouse and that's where we're trained to cure and trained to stabilize, we surely could be we're the ones that really should do that. So it would be fair to say that you can be healthy and you can be sick. You could have a cold and you could have a healthy mouth. But if you have a sick mouth, if you have inflammation and you have infection in your mouth, it's impossible for you to be totally systemically healthy. And so as we get closer and closer to identifying that, it would be, we have to educate our patients, and we have to share with them resources on how to eliminate oral inflammation. So that's what we do for our existing patients. We develop a strong periodontal policy. We make sure we enforce that. And even after we do that, or before, arguably now today before, everybody's airway should be evaluated for breathing disorders, daytime breathing disorders that could lead to nighttime breathing disorders, because many people have breathing disordered sleep, and they have poor respiration, which is a function of breathing, and they have poor oxygen exchange, which also drives up inflammation. And we would more commonly, Mark, know it as sleep apnea or sleep disorders. And so periodontal disease and sleep disorders in the dental practice is going to be some of the lowest hanging fruit that if you develop policies around of how to identify them, how to diagnose it, how to treat it or stabilize it, and then how to collaborate with our medical professionals about what we did, that would be, that's the hallmark. That's the basis of what we're going to do for our existing patients. For our new patients, you're going to start with a comprehensive exam like we do for all of our new patients, but you're going to use your goals of end therapy for periodontal disease management and sleep apnea management to try to hold those patients to that standard. And if they don't meet that standard, then you would obviously offer suggestions. And one of the things that I think we've made a mistake in dentistry is we've blamed our patients for not being healthy. We've blamed them for being almost neglectful, if you will, because they don't clean their teeth well enough, or they don't perform hygiene procedures as well as they should. And what I'd like to do is I'd like to put the onus on the dentist to say, I don't think most of my patients have a learning disability. Most of us have a teaching inability. And if we could teach our patients more of what to do, these patients, once you start focusing on wellness and talking about wellness, they're very eager to learn, what can I do to be healthier? Most of them, because that's what they come to you for. So I think with our new patients, starting with a comprehensive exam and evaluating periodontal health and their cavity risk and their risk for erosive or environmental issues that cause tooth destruction, which could be acid reflux and other things like that. And then to look at how their teeth fit together. People need good teeth to, we call that bite disease. People need good teeth to be able to function. And then obviously doing a thorough oral cancer, extraoral and intraoral cancer and head and neck exam. And then looking at airway and airway management issues and signs for early airway developmental issues, tongue ties and breathing disorders, functional, anatomical, and behavioral disorders that we can identify in our patient base. And then look at, obviously, I evaluate appearance last unless they come to me for that. It used to be that I was a cosmetics center, and now I'm a health and wellness center. And the cosmetics are quite secondary to the health and wellness stuff, but it's still very important, and it's in there because sometimes people come to me for that because they know I'm a fine restorative dentist. So starting with a comprehensive exam, Mark, and then giving the patient some type of written report, whether it comes through predictive software like the Evidentia software that we're trying to develop at the Coy Center, and we are developing, or whether it comes from something that you write down on a piece of paper in an organized fashion in those 7 key dental element areas of what your assessment is. So the patient can walk away and say, I know where I need to invest my health dollars or my wellness dollars. I need to put it all in perio, or I need to get evaluated for sleep hygiene or sleep medicine. Once those patients know where that spend their time and their money, then they'll usually do that. And Mark, I would say that whatever you focus on in your patient exam expands. If you focus on insurance and just talk about insurance, that conversation is going to expand. And you're going to have to walk down the insurance road and explain why the insurance doesn't cover this and doesn't cover that. If you focus on health and wellness and have the patient understand how their condition is a disability, and what it means to them, and how your belief and your passion of how if they're healthy and they're well, that many of those diseases will subside or will require much, much less invasive treatment. Most of those patients in most practices will find a way to pay for that care. And
I have to go to in this conversation, what comes up for me is, I am an unabashed supporter of what you're speaking to. And then I'm also in recognition of an industry in which all this occurs. And, dentists usually do what they get paid for.
sure.
And there's a certain level of understanding in health and wellness. I don't know how expanded it is into the markets that they're serving or how they make their money. How do you see the industry shifting, the context shifting, so that this is appreciated by the people who manage the third parties and employers and all that stuff?
Well, I think that people who are managing patients' overall health from a financial standpoint, if that's what they're trying to do, I think that we definitely need to make sure that we have clear periodontal goals and what the goals are of periodontal treatment. We have to get patients periodontally sound. It's the most impactful entity that we have to work with, and that's why, our course. And one of the courses that we do at the Coy Center is integrating periodontal medicine to reduce systemic health risk. And that's really how I would say it, Mark. If you have very stable periodontal disease, you are going to eliminate some systemic health risk. And who's going to ultimately pay for that is going to be up for grabs. But I do think that when insurance companies, if that's their goal, is to keep patients healthier and reduce future health expenditure costs, someone's going to have to put their foot forward and help identify and create the parameters for how we're going to do that. And I'm happy to be part of that. But I think that from a wellness, from a dentist, a restorative dentist that has walked down a path and added a significant portion of wellness opportunities to the practice, the financial remuneration comes from the development of a reputation and a brand, not just by using some dental code. And I have cardiologists that send me patients for sleep evaluations for all their patients with AFib. I have doctors who send me patients for elevated HSCRP, elevated myeloperoxidase, elevated inflammatory biomarkers, and they can't find the source of the elevation. So you start to get these referrals that are very different than I broke my tooth, I have a toothache. And that happens over time, and that happens from developing a reputation and a brand. So I think I would be misleading the population, Mark, if I said you could take a weekend course and on Monday you can enter the world of wellness dentistry and you can be proficient. That wouldn't be true. And so you grow into it, and you grow into it through one relationship with physicians at a time, or what I think you may have the ability to do, Mark, and that's put people together who can jumpstart the system by creating some leverage and some economies. People that, where maybe you could speak to 100 people at a time instead of 2 or 5. And we could expand the base a lot more by stretching, by broadening the scope of our message. That would be really helpful.
One of my mentors once said, your business is perfectly designed to get the results it's getting. And what you're talking about is a change in design. And my experience in the field is, we have Coyce and we have Spears and we have people that at that tier that really want to be at the leading edge. But we have a lot of others underneath that treat a lot of patients. And my question is people do what they're mandated to do, either by the money or by government or by structure or by AI. I think artificial intelligence and cloud computing and all the things that you and I have talked about on the side is going to influence the speed at which this is adopted, because it's got to be, because it costs too much. I'm just wondering how, when you talk to dentists, you offer courses, right? You do all that.
I do.
So I'll talk about that in a minute and how they come to you and then what happens. And
yeah, well, I've been given the privilege to be asked to be part of the faculty at the Coy Center. And I think all the centers, the Dawson Academy, I don't want to speak for Scottsdale, There's some groups I can't speak for, but if I look around at the dental course offerings, including the American Academy of Oral Systemic Health, even the AES, which used to be known as the American Equilibration Society, I'm on their program this February. But here's a program, Mark, that was designed about how the teeth fit together and what the and the function of the jaws from a sophisticated function setup. Even these groups know, and now they're shifting the message to bring wellness concepts and health and wellness concepts into dentistry and into their member dentists. So many of us are starting to learn more and more how to deliver these messages. And so I'm doing it through the Coy Center. I'm doing it through typically dentists who have gone to schools of higher levels of education, and then they call me and they want their staffs trained, they want their teams trained, and so we make road trips to all over from Hawaii to Maine, and international. I'll be in Spain later this year, where we are delivering health and wellness message. And what I can say, Mark, is this: the message resonates very, very well with dentists, but we are just scratching the surface of how to bring this into practice in a productive way. And as you mentioned, if we're trying to get away from those dentists that are spending lots of resources on higher education, how do we get to the masses of the more average dentist? To your point, they're going to have to be remunerated or compensated in some way. And I think it would start with having a defined endpoint, a clearer defined endpoint for periodontal disease management, and making sure that we have patients that have periodontal disease managed properly.
Two things, and then we'll kind of close this thing down. Number one is I admire your courage and leadership to stand for something and to make sure in the face of not a lot of agreement is very difficult. So that's leadership for me. And the second part is when you take a stand, usually what you get is resistance to that stand being manifest. I mean, that's the way the universe works. Where do you see are the next wave of resistance you need to break down?
Yeah, it's funny because 10 years ago, not even 9 years ago, I would go to a course and I would ask who in the room is familiar with salivary diagnostics, and no hands would go up. I mean, 0 hands would go up. And now I'm in the room and it's about 40% of the people have either done bacterial testing or some kind of testing. And I think right now we're gaining more and more momentum. And I think, if I'm not mistaken, Mark, I think kind of chiropractic care did this some years ago, where they started to branch out into much more lifestyle coaching and health and wellness concepts. And I see dentistry following kind of that same footsteps. And so we'll figure out whether it's through consultative care, whether it's through some kind of collaborative care. Obviously, I'm not suggesting money passed back and forth, but through some kind of collaborative care, I think that we're going to get more and more acceptance. I think for each practitioner, they need to start with their 1,000 to 3,000, patient base, because the patients get it. So whether the insurance companies or the people who are pulling the strings that they get the dentist to do what they need to do, I think that the dentists need to continue to share this with the public, because the public's acceptance of the message is widespread. And not only that, the patients, they say to me, "Oh, I heard about that." When I would tell them a story, or I would share with them why I'm concerned about their bleeding, and, "Oh yeah, I know about that," or "My sister's really having a hard time with that." It's not new news to them. So unfortunately, what's keeping dentists, I think, from getting into more this quicker is a lot of dentists are already successful. They're already doing quite well, and they're running as hard as they can to try to meet the demands in a tightening insurance-driven world. And we have a lot of pressure from different entities in dentistry, and it's only a matter of time before some of those dental entities catch up and even surpass the quality and the technology and what's going on in the small mom and pop practices. But it takes a somewhat of a niche practice like mine to create this message, and I've had so much success with it. I would love for other people to consider what the benefits could be to a larger patient base in a whether it be part of an ACO. I know guys who are developing large accountability care organizations are putting dentists in the dentistry and oral evaluation has to be part of the wellness concept, and you will not have consistently healthy patients where the oral cavity and the potential damage from oral infection that's existing is left unchecked. That's for sure.
That was a great ending because it's the truth. And I think that dentistry has to wake up to the fact that they're responsible too, and that they're not just repairmen. And so that whole contextual shift is going to be wonderful to be around. I want to thank you for your time. I want to thank you for your leadership. I want to thank you for not giving up and for, keep on punching, man. This is really great.